In this video, we're going to be discussing one of the special tests used in the assessment of IT band syndrome, and that is the Noble compression test. But before we get into that test, let's review a little bit of the relevant clinical anatomy and physiology. So IT band syndrome is an overuse injury of the tensor fascial lata muscle, or TFL, and the associated iliotibial band, or IT band. You can see here that the muscle belly of the TFL resides on the anterolateral hip, where it originates from the ASIS up here. The muscle belly descends inferiorly and eventually fuses with the IT band, which runs down the lateral thigh and eventually across the lateral knee, where it inserts on Gerdy's tubercle of the lateral tibia. Now here's an important question. What differentiates walking from running? Well, in walking, there are periods of double limb support and there are periods of single limb support, and it alternates between the two. However, in running, the mechanics are characterized by having no instances of double limb support. Double limb support is eliminated in running, and there's alternation between single limb support, either on the left or right lower extremity, and a completely airborne state. So during running, while a person's in single limb support, it's extremely important for the lateral hip musculature to activate appropriately in order to stabilize the body in the frontal plane. It's not that you don't need frontal plane stabilization during walking, it's just that during running, each instance of single limb support occurs more quickly, which is where you need that frontal plane stabilization, and the body's also having to absorb more force because you're moving faster and hitting the ground a little bit harder. And those lateral hip muscles that must activate are the gluteus medius and minimus, both of which are more posterolateral, and then the tensor fascial lata muscle, which is more anterolateral, as you can see over here in the picture. And we know that the TFL is going to fuse with the IT band, which then inserts on Gerdy's tubercle over on the anterolateral tibia. Now, ineffective frontal plane stabilization due to weakness or impaired motor control of the gluteus muscles, so gluteus minimus and medius, causes increased reliance on the TFL. So for frontal plane stabilization, each of those three muscles has some percent contribution that they have to provide in order to provide appropriate frontal plane stabilization. Well, if the gluteus medius and minimus, let's say, are weak, then they're going to be providing a smaller percent contribution than they ought to, which means that there's going to be increased reliance on the TFL. But the TFL is not meant to provide that increased reliance. It has to share the load normally with the gluteus muscles. And so if you have that increased reliance on the TFL, this leads to eventual overuse of the TFL, tightness in the TFL and the IT band, and lateral knee pain. And that lateral knee pain down here is due to, when you have the tightness in the TFL, you have increased pull on the IT band, so the IT band becomes more taut, especially distally. And when it's more taut, it increases the likelihood that as you run, as your thigh goes into flexion and extension, you're going to have increased friction rub against the lateral aspect of the femur, and that friction causes pain. Now, we already know ways to assess for a tight tensor fascial lata. That would be the Ober test, which we covered in a previous video, and the Thomas test. But the iliotibial band friction is assessed via the Noble compression test, which is going to recreate the sensation of increased friction against the lateral knee due to that excessive tension in the IT band that occurs when you're running. So now that we're all on the same page with regards to the relevant anatomy and physiology, let's take a look at the Noble compression test, which in theory is a special test that is specific to diagnosing IT band syndrome. Now, there's a couple variations of the initial patient positioning for the Noble compression test. I'll be demonstrating this with the patient positioned in hook lying, as you see right here, and their knee is bent to 90 degrees of flexion. Notice also that their hip is bent to 45 degrees of flexion. The other variation is the hip will actually be at 90 degrees, so the thigh will be vertical. The knee will still be at 90 degrees, and so the tibia will more or less be horizontal. So similar to what we did in the hamstrings at 90-90 test. Okay? But either way, the knee needs to begin at 90 degrees of flexion. Now initially, the PT is going to apply a compression force to the lateral epicondyle of the knee, or about 1 to 2 centimeters proximal to it with their thumb. The whole point here is you're trying to put a compression force over the iliotibial band. Okay? So the first thing I need to do is I need to palpate the lateral epicondyle, which is about right there. And then I'm going to move about 1 to 2 centimeters proximal to that. Now, the way I'm actually doing this is I'm applying the force over the entire length of my thumb. So I'm applying the force from the pad of my thumb under my thumbnail all the way down to the MCP joint. And that's pretty much just guaranteeing that no matter how the IT band shifts during this movement, I'm going to be compressing it against the lateral femur. Okay? And so once you have a firm compression on the IT band, you're going to bring the knee into full extension. So maintain the compression, move the knee into full extension. Okay? And you can always bring it back to that 90 degrees of flexion. Now, what constitutes a positive test? A positive Noble compression test is indicated by the reproduction of familiar lateral knee pain near the lateral epicondyle, or at least in the area of the distal IT band, normally around 30 degrees short of full knee extension. So here I am on the right side, 30 degrees short of knee extension. This is around where I would expect the patient to report pain if this test was going to be positive. And if it's positive, that's theoretically a good indicator that the patient has IT band syndrome. Now, the reason I say theoretically a good indicator is because the psychometrics, the sensitivity, specificity, have not been assessed. So use caution when interpreting the result. Let's take one more look at the Noble compression test. The patient will be positioned in hook lying, test side knee flex to 90 degrees. The PT will then find the lateral epicondyle, and they can move 1 to 2 centimeters proximal of that and apply a firm compression over the distal IT band. And then from that position of 90 degrees of knee flexion, move into full extension, maintaining that compression force against the lateral epicondyle or the IT band. And again, if the test is going to be positive, it would be indicated by having lateral knee pain about 30 degrees short of full knee extension, about at this point right here. Thank you for all your support. Be sure to check out my Instagram for cool science and not science stuff.